Welcome to Let's Talk Kids. I'm Mary Coogan, President and CEO of Advocates for Children of New Jersey and the host of Let's Talk Kids, a video podcast of conversations with experts, community organizations, and policymakers about issues impacting children and youth. Today, I'm joined by Elizabeth McCarthy, who's the President and CEO of the Community FoodBank of New Jersey. So glad you could be here today.
Thank you so much for having me.
How did you come to work at the Community FoodBank?
I had worked in social services for most of my career, never in food related exactly, but I worked in areas that impacted families with poverty. So early childhood education, foster care, juvenile justice. And a big part of that was always finding the same thing, that these families were struggling in many aspects of their lives. When the pandemic hit and I was at an organization called Sheltering Arms, we found that a lot of our families were saying, like, I have to skip my mental health appointment because I don't even know how I'm getting dinner for my kids tonight. And really just those needs really just exacerbated in such a short period. So we opened a few food pantries at our site, so just for the population that we served. And it was really my first entree into that, kind of seeing a mental health clinic, for example, as really a hub of wraparound services for people. And so when the headhunter called and asked if I was interested in the food bank, I mean, I'm from New Jersey. I certainly knew the work of the food bank, if for no other reason than I go to Bruce Springsteen concerts and he would talk about it. And I was intrigued because it's sort of the opposite. It's sort of starting with food and then leading people to other services that they need. And so luckily it was a good fit and I was very excited to join.
Well, that's great. And I know acnj, our board and staff, 2 years ago, we did our volunteer day at the food bank.
Yes.
And to me, it was an amazing experience. The place is huge and it does so much more than food. So let's talk a little bit about what happens at the Community Food Bank.
Yeah. Well, first of all, the volunteer experience is amazing. And we have altogether, we would have to hire about 40 more people if we didn't have volunteers. We have about 80 to 90,000 volunteer hours a year. So it's incredible. Every day there's corporations, families, sports teams. The New Jersey Devils were there the other day. It's really exciting. But a lot of what we do, as you say, is food. And that means a lot of different things. So it means providing food to food pantries and soup kitchens, senior feeding programs. But it also means some direct meals. So we do meals for children and after school programs, and they're actually made right there in our kitchen. We do medically tailored meals for some populations. So for people with diabetes or high blood pressure, that all comes right out of our kitchen. And then we also do workforce development. So we work with some populations, mostly people who've either had some time in prison or have some other reason that they're sort of struggling to find work right now. And we do a culinary training program and then also a warehouse logistics training program. We also do nutrition education and we do a lot of outreach around SNAP. So yeah, there's a lot of different ways that we're sort of serving the food insecure population.
And you cater, correct?
We do, yes. If anybody ever wants a party catered, we have chefs there and our students who are learn to do these events. And it's really wonderful. They get hands-on experience. And I think people also really like the connection to the food bank when they hire us.
So I didn't know that you did specialty meals for people who have health issues. So
yes.
How many of those meals do you typically
It's pretty small programs, but it's also related. We did a couple years ago, I guess about 3 years ago, put a nutrition policy into place for the food bank as a whole. So trying to make all of the options that we give people healthier, as well as worked with a lot of our pantries that if someone comes in who does have one of those conditions, they almost get like a shopping list so that they know which food to choose. So we do some senior meals and then some of the medically tailored meals, but it's relatively small. Again, a few thousand of meals as opposed to the millions of meals that we serve to the population as a whole.
So if I need food, do I just show up at the food bank or am I picking my food up someplace else?
No, it's a great question. And I think people get very confused between what's a food bank and what's a food pantry. And we actually run both. But if you think of the food bank as kind of the wholesaler and then food pantries, soup kitchens as sort of the retailers. So if you came to the food bank in Hillside, if it was an absolute emergency, we'd find a way to get you some food. But really, that's not a place where you get food. We would refer you to one of our pantries. You can call, you can go on our website, you enter your zip code. It'll tell you where the food pantries are near you, what the hours are. We try to really get people to resources right in their community. We do run 3 pantries, which not all food banks do. One in Bergen County, one down in South Jersey, and then we have a mobile that actually goes around to really hard to reach populations.
So website, what is the website?
cfbnj.org. And that's where you can go to learn how to volunteer or to donate food or money or to find food for people that need it.
And then how many pantries are you the wholesaler supply for?
Yeah, we work with about 800 partners.
Wow.
So yeah, it's a lot. Throughout 11 counties in the state. We cover 15 altogether, but the other 4 are through affiliates. So the 11 counties in which we work, there are 800 partners. So you'll see our trucks out on the road every day, bringing food to those partners. Again, it depends. It could be a pantry, so they're getting shelf-stable food as well as produce and proteins. But some places are soup kitchens, so they're getting food that they can make into meals. And then some, they're getting actual meals, so like our child after-school programs.
So I remember when we were there, we were taking certain things and repacking stuff into boxes.
Yes.
How does staff there decide what you get, your 800 partners?
Right. It's pretty complicated. We try to use data on where food insecurity is the most and the number of people that are served at that pantry. So some of our pantries are huge. And you'd go to one, and most people, we prefer not to hand people a box of food. Most of our pantries today are choice. So somebody goes there, it almost looks like a small grocery store, and they can go through and pick out their food. The boxes are great for people who are getting home delivery, or for seniors who maybe can't, come and shop at a place, but could have us put that in the trunk of their car. Or for people who right now are afraid to be out at food pantries. We have specific boxes that we're working with some immigrant groups to get those boxes to people. But mostly we like people to have some choice in what food they're picking.
And it's more than food.
Yes.
Right? So what other things are you supplying families with?
2 of our big programs, and people are kind of surprised to hear that these are really about economic stability, diapers and period products. And the reason why is if you don't have enough diapers for your child, you cannot bring them to daycare and you cannot go to work. And we hear from families that that is something that they really struggle with. They're expensive. You can't use SNAP to buy them. And they have to have a certain number to be able to bring their child to daycare. And then period products, it's astounding. But in 2026, there are women missing work and girls missing school because they don't have the proper hygiene products. So those really are, a lifeline for people and for their ability to be in the workforce. So those are the big products that we also will do. If we get donations of toiletries or things like that, we'll bring those to the pantries also. But the big programs are diapers and period products.
I'm hesitant to even ask, but I'm going to. How many diapers a year are you sending out into the community? A rough estimate?
100,000 or so, probably.
Wow.
It's a huge amount of diapers. And again, that is, if we could do more, people would want us to do more. It is one of the most sought after items.
Where do you get your supplies from? Who supplies the Community Food Bank?
A number of sources, and it falls into 3 main buckets. One is federal food, which has been down dramatically in the last couple of years. The one is purchased food, and that is through funding from the state of New Jersey, and also through funding that is raised through our private fundraising. And then the last is donated food. And that can be everything from, the baseball team that decides to have a food drive and brings you 1 carload full of food versus, huge food wholesalers and retailers in the state of New Jersey who donate truckloads of food. So that has to come into the warehouse, kind of be sorted, and then goes back out to pantries. But it's the federal food and the donated food are unpredictable. And that's one of the challenges.
What's the federal food?
So the federal government actually supplies direct food. It can be shelf-stable food. It can be produce. It's kind of wherever they have a surplus of something, it will come to us. But again, we don't exactly know what's going to come, when it's going to come, and we can't count on an amount. So that's the thing that makes it pretty challenging.
I didn't realize that. So it's like a surplus almost.
Yeah, it's called TFAP. Some of it is through because we give farmers subsidies, and so they're still producing things, but don't necessarily the federal government is kind of paying farmers to keep producing it, and then it comes to us. But it's sometimes you'll get, all of a sudden 3 truckloads of grapes, and they don't have a very long shelf life, so we have to very quickly get them out to the pantries, and it just causes some struggles in our distribution.
So who makes up the schedule of the wholesaler to the 800 partners?
Yeah, it's very complicated. We have a team called our fulfillment team that works. And what makes it it's funny because we go visit, we have a board member who runs a beverage distribution program. He had us come in, look at the warehouse, look at how they do their routing. It was a great experience. But here's what's different. If he's delivering to liquor stores, they're open, most of the day. They can take their delivery really almost any time. Our food pantries, many run through volunteers. So they're saying to us, if you can't bring this between 8 and 10 in the morning, we can't take it, because that's when our volunteers are there to unload it, to pack it into the shelves, to do those things. So people have very small windows of when they can actually accept deliveries. So it's a constant negotiation. Like, here's where we think we can be there. When do you think you can be there to have people to empty it? We're trying more and more to use some of our larger pantries as kind of hubs. And they've been wonderful about agreeing to that. So if we have a large pantry and it's in, Morristown or somewhere, which we actually do work with one in Morristown on this, the smaller pantries can come there and pick up their food. Or, they can take their van out and bring it to them so that they don't necessarily have to have people available to unpack on different hours.
So have there always been that many partners, or is this whole food distribution system grown over the past few years?
COVID, it grew a lot. And we brought on a number of new partners during COVID. And so now we're really kind of looking at that map, assessing, I don't think if you built a food distribution system, you would have 800 partners, quite honestly. They're all doing good work. It's not to say that they aren't, but there might be a time where we kind of have to say, you know what, it does not make sense. We have 4 pantries on one block, and yet then we have this other area that's underserved. So we're always looking at that and looking at our data and trying to figure out what is the best way to make sure that food is getting to the people who need it most.
So you're really a logistics person.
I am now. I actually really enjoy it. It's fascinating. I've, as I said, I worked in social services most of my career, but I had never, had a fleet of trucks or a warehouse. And that is a very different aspect of this work.
Good for you. Are there other community food banks in New Jersey? I mean, I know of at least 2. How many are there?
Yeah, so the Food Bank of South Jersey has 4 counties kind of in the Philly suburbs, that area. And then Fulfill as Monmouth and Ocean County. Then our affiliates, Mercer Street Friends, which has Mercer County, and Norwest Cap has the 3 counties kind of in the northwest corner of the state.
Are all the food banks coordinating now?
One of the most pleasant surprises for me when I took this job is how much the CEOs all talk to each other, get along, work together. It's really nice. It's not, an official coalition of any kind, but we, at least every other week, we are on the phone together. We are talking about what's going on and how it impacts us. If one of us needs something, the others are there to help. So one had a power outage. We sent some refrigerated trucks. And there really is a very collaborative relationship, which is really nice to see.
Okay. Which is wonderful to hear.
Yes.
There is a collaborative relationship. So let's talk a little bit about the people you're trying to get the food to.
Yep.
How many people, and I know I've heard this term before, food insecurity.
Yes.
Could you explain what you think of food insecurity as being, and how many people in New Jersey do we say are food insecure?
1.1 million and growing. It is a lot of people in the state of New Jersey. And people think of New Jersey as a wealthy state, and it certainly is in pockets, but also every single zip code in New Jersey. There are towns where people would say, oh, nobody there is food insecure. They are. Because food insecurity, the reason we use that term and not hunger is because what we're talking about is consistent access to healthy, culturally appropriate food that enables you to live your life in a thriving way, so that you can go to work, that you can go to school, that you can do all those things. Hunger is more of a physical sensation, almost like we've all felt hunger. That's very different than knowing that you're going to be able to feed your family healthy food that is going to help them develop properly.
And it's over 1 million. I think there's 9 million people in New Jersey,
yes.
right? So it is a significant amount.
It absolutely is.
And that's probably grown since COVID, is that?
It has grown significantly since COVID. And a lot of it, it's complicated because people always ask that, well, why is it? And everything has gotten so expensive. Rent is more expensive. And especially when you do live in an expensive state, those things really hit. Right now, gas is something that is just so expensive. Groceries, childcare, as you certainly know, is a very expensive thing for families. And so, food is available. You can go to a food pantry and get food. You can't necessarily go to, somewhere else to get somebody to give you rent money. There are some programs, but it's much harder. So I think people do turn to the charitable food system when everything else is putting them at a breaking point.
Would people be surprised if they knew who the 1.3 million people are? What are the myths about who is suffering for not having enough food?
Absolutely. I mean, yes and no. I think nobody's surprised that a lot of it is people who are living in poverty in general, who are just at that line. But so much of it, and we saw this in November when the shutdown happened and people's SNAP benefits were cut. So many people in the lines that came, and the lines were miles long at the distributions that we did, said, I've never asked for help before. That it was just they're living close enough to the edge that having those SNAP benefits go meant they had nowhere else to turn. And so it is working families. I mean, 80% of the people on SNAP are working families. I don't think people understand that when they hear about SNAP cuts. They think it's somebody who's, asking for a handout or not willing to work. But most people are, some more than one job. Like one of the biggest searches we get is what pantries are open in the evenings, because people need to go after work or after picking their kids up from school. So I think that part is surprising to people. And how much could be a family that that was doing fine. And then somebody got really sick and had health bills that they couldn't cover, or somebody got in a car accident and had to buy a new car. Somebody got laid off, not expecting it. And all of a sudden they find themselves in that situation. So it's pretty eye-opening when people come to pantries.
So you mentioned SNAP benefits, which I understand to be the Supplemental Nutrition Assistance Program, which, just for our listening audience, is what we used to refer to as food stamps,
Exactly.
right? Now, that's an income eligibility program. So what you're saying is, the point being that it's many people who are working but close to the poverty line, right?
Exactly. And it depends on the number of people in your household and, all those things. So yes, it is income. And it is one of the other myths that we like to dispel. It is only for citizens. So it used to be that people on refugee status could get SNAP. They no longer can as part of this bill. So I think one of the myths is, undocumented people are stealing all this government money. It's simply not true. There's a very low fraud rate in SNAP. It's known to be one of the most efficient programs. And so I think it's just really important that people understand that when they hear about these SNAP cuts.
So, and refugee people are people who are here legally.
Absolutely.
People who have just wandered over the border and undocumented, as you point out, have never really been eligible for SNAP benefits or other.
Right. And the SNAP application, like if someone sat and went through it, it's a lot of information. So it is not like somebody could just say, oh, yes, I'm a citizen and get food. I mean, it requires a lot of documentation, which is why we have staff who are going out and helping people with these applications, because they're complicated.
So you have staff that does that?
Yes.
Who are those?
They're called SNAP navigators, and they go out. Mostly we'll work with some of the pantries in our network we go to schools, we go to different social service organizations, and we try to have them announce to people in advance that we're coming so that they will bring their documentation if they have it, but they can upload it on their own later if they know how to do that. Not everyone does. Or we can come back, or they can call us and we can walk through it. And then we also have a mobile unit. So our SNAP mobile unit sometimes goes with our mobile pantry, so you get both in one place, but sometimes goes to senior housing or some of the hotels in South Jersey where people live, and really sort of try to work with them to get them benefits that they're eligible for.
And then you mentioned the fact that there's SNAP cuts. Now, my understanding is it's that the eligibility has changed, right?
Yes.
So there are some people who are here, a certain refugee status, who are no longer eligible for SNAP, but there are other requirements, a work requirement now, right, that is changing.
Exactly. And certain populations that used to get a waiver from that work requirement that no longer do. So veterans, we know that a lot of veterans are living with mental health challenges that they don't get, a diagnosis for, that they're not willing to do that. There's still a stigma, unfortunately. People aging out of the foster care system, same. We know how much those kids struggle. And so they used to have a waiver and no longer will have that waiver. So there are very vulnerable populations that we're very worried about as these go into effect. And it's not even just, people are willing to work most times. It is that the paperwork that's required and the kind of compliance that's required, and that it has to be 20 hours every week. Whereas, we have people who do seasonal work. That in the summer they might work tons and tons of hours, but there's not as much work in the winter. Or we had a woman who was at one of our pantries who's a school bus driver. She works year round. She doesn't have work in the summer. Those people can actually fall out of eligibility now because they cannot meet the every week requirement. And if you miss it for 3 months, you are not eligible even to apply for SNAP again for 3 years. So we're really very, very worried about the number of people that are going to start turning to pantries because they have nowhere else to turn.
And how are people learning about this requirement? Which I understand it's work or going to school or you can volunteer, but to your point, you still have to document it somewhere and it's got to be uploaded. I don't know that we have figured out all those logistical things.
No, we haven't. And 20 hours is a lot to even as I said, we use tons of volunteers. It would be hard for us to absorb a large number of people to volunteer 20 hours every week and document it and give them a meaningful, work experience there. So imagine for very small nonprofits, like having volunteers, maybe 1 or 2 for 20 hours, but you're not going to be able to reach large segments of the population. To answer your question, how are people finding out? Unfortunately, many are not. And the way they will find out is that they will no longer get their SNAP benefits. And there's a few reasons for this. I mean, information is sent out. It is not very digestible. Unfortunately, we're trying to work with the state to have everything go out in no higher than a fourth grade reading level and to go out in multiple languages. That's been slow to happen, and not even the fault of the state so much. It took a while for the guidelines to have clarity from the federal government. But I think people don't always read their mail, and, we all should, but I'm sure I've missed a thing or two in my mail. I think that happens to a lot of people. And so they don't know, and at some point they will just not be eligible anymore, which is very scary. So lots of social service organizations trying to make sure that people who come to them know. We have a program called Snapshot where we're trying to get information out to people. I know some counties have great social media, text alerts, et cetera. So everyone's trying to inform people, but I think we still every day have people who come to a pantry and say they had no idea that this was changing.
What do we do about it then?
Yeah, we keep trying to educate people, and I think use as many venues as we possibly can, like digital ads, like social media, like word of mouth, like getting somebody who has a WhatsApp group with their community that is in Spanish and they can get word out to people. So really trying to use grassroots kind of movement to get people to know. We are going to probably have people knocking on doors in communities where we know there is high SNAP usage and leaving materials, making sure that people understand. And we'll have QR codes to the government forms so that they can find out exactly how it applies to them, because it's complicated. But we just want people to know to ask, because right now people don't even know that they need to ask and that they need to understand that it's changing.
Just as you're getting me thinking, are there social media influencers, anybody who's taken on this food issue?
There are certainly something called the SNAP Challenge. We've had a few influencers who've done that, which has been very eye-opening for people, I think. And I've actually done the SNAP Challenge. It's hard. The challenge is to live on $6 a day for all of your food. The challenge is to only do it for 3 days. And it was hard for me to do it for 3 days. So imagine if that's your life. I mean, how difficult that is. But so we definitely had people when the HR 1 was going to be passed, and we had people calling all the time and trying to get it not to be passed. The influencers, I think, were great for that, for getting the word out and making people understand this is not a huge amount of money for a family. I think, again, sometimes people have this conception like, oh, they're just sitting there getting this handout. It's $6 a day on average. So it's really just to supplement and to help people who can't make it to that next paycheck. And so I think once you try to live on $6 a day, you understand what families are going through.
Do you have any thoughts on what is the impact on child development, on learning, when kids don't have consistent, nutritious food?
Yeah, we talk to educators all the time, and it is kids who come to school hungry, often can't focus, will fall asleep sometimes, will come to school and, they've had kids, kind of having to try to go to get the breakfast or lunch, even if their parents haven't filled out the eligibility forms yet, which is why universal eligibility would be such a wonderful thing. And plus, there's still a stigma for kids sometimes about those school meals. It absolutely not only has an impact on kids today, which it does, certainly, their ability to thrive in school, but more and more the research is showing that even short periods of food insecurity in childhood can have lifelong impacts, so physical and mental health. The shame of it, the living that way, the anxiety of not knowing where their next meal is coming from, and then just the poor nutrition. Even kids who aren't necessarily hungry, as in their stomach is full, unfortunately, cheap food is usually not as nutritious. So when families are, working 2 jobs, rushing to do things, they are more likely to have fast food or whatever they can quickly find that is relatively affordable, but not necessarily nutritious for kids. And that, too, has lifelong impacts. I mean, the impact of diabetes and high blood pressure we know, are going to keep people out of the workforce as long, are going to really sort of cause problems for the rest of their lives.
So I know the school meals program is fairly successful, right? And there's meals that continue into the summer. But I also know from our Kids Count data, only 60% of kids who are eating lunch are also eating breakfast, right? So
Yes.
There is some, not consistency or inconsistency in terms of making sure kids are getting meals at school.
Yeah, and there is some work being done to try to get a bill for universal breakfast, or at least to have free breakfast available in school, and what they call, I forget exactly what they call it, but breakfast on the go, basically. So I think it's breakfast in the classroom, so that somebody can get something that they can take with them, because it's hard to, if you're already getting your kids to school, getting to work, can you necessarily get them there earlier? It's hard for some families. So something that they could eat, in their homeroom period or something. Yeah. And it does make a big difference. I know New York City saw a huge change in that, and it helps attendance. Honestly, when kids are going to get meals at school, the family is more likely to do anything they can to get them there.
Oh, that's interesting, because we do have a chronic absenteeism problem, right? So
exactly.
That's the way they solve that.
Yes.
What about the older kids? What about the college kids? Do they have a food insecurity issue too?
I'm very glad you asked, because it's huge. They say 1 in 3 or 1 in 4 college students, which is a mind-boggling number, struggles with food insecurity at some point in their college career.
Now, is that nationally?
That is nationally. But New Jersey definitely mirrors that. And yes, it's more in community colleges and things, but it is every single university. Because, a lot of people you might get a scholarship to Princeton. Maybe you even get a scholarship with room and board. But if your family is living in poverty, you might still struggle. I guess not if you get room and board, but if you just get your tuition, then, getting gas to drive there, getting housing, getting all those things are really a struggle. So kids, you wouldn't necessarily think that students at Seton Hall and Rutgers and Princeton would struggle, but there are food pantries there that we work with to try to make sure that those young people can, and not always young people, it's adult students also, but can get food, because we want them to stay in school. And, that's the path that they're going to take to not be food insecure at some point, which is the goal at all of our pantries, is to have people get to a point where they don't have to come back to us. And so the college pantries have just been amazing, and really trying to work so hard at not having any stigma involved, making sure that people feel welcome, that they can go there and get some of their meals or groceries or toiletries.
So are you at all concerned, as the SNAP work requirement changes, that the food pantries, the need might increase and they won't necessarily be able to fulfill the need, or the wholesaler, the Community Food Bank, isn't going to have enough food to supply the pantries?
To say I'm concerned would be quite an understatement. Yeah. Starting today, really, because the work requirements went into effect 3 months ago. People had 3 months to get compliance. We expect that in May, people will start to be removed from SNAP. For every meal that we provide, even though we provide about 100 million meals, and the other food banks add to that, SNAP provides 9. So when you think about what those SNAP benefits are doing, first of all, it's keeping people out of having to come to pantries, which is not the best way for people. You don't have as much choice. If you can go to a grocery store and have something to help, that's probably better for your family. So we cannot absorb that much if SNAP were to disappear, which in some states it might. New Jersey will not let that happen, but there will still be some SNAP benefit. But yes, we're incredibly concerned that we will not be able to serve everyone at the food pantries.
So if you had your magic wand, what would you change? Is this really the best way to address a food insecurity issue? Even just the public benefits, the meals, and then having a community food bank and pantry system?
It is definitely not the best way. Things like the childcare tax credit that we used to have were incredibly effective at keeping families out of poverty. And that included food insecurity. Things like SNAP, is it ideal? Maybe not, but I think it's pretty close. That people can go to the grocery store they're going to anyway. They're probably paying for some of their groceries themselves, because SNAP doesn't cover everything, but it sort of gives them that buffer to get them to the next paycheck. The pantry system is absolutely not the best way to do it. It's great that we have it, because people would truly be going hungry if we did not. But absolutely, I think for families themselves, I think any family would tell you they'd prefer to have SNAP and be able to go to a store or a farm stand where they can pick their own food.
So you mentioned the farm stand. So I know New Jersey had a pretty robust system of farm to table, right?
Yes.
And I also know that some of that was cut, because there was compensation from the federal government to the states to implement that program.
Yes.
Do we still have those programs? What's the status?
The program was eliminated. The local food purchasing program is what it was called. That was part of HR 1 as well. But we do have in New Jersey, we're very lucky. Again, we get funding from the state to buy food. And so we are still working with some of the farms. Particularly, there's one called America's Grow-A-Row out in Western New Jersey. That's a nonprofit farm that really everything they produce is for food pantries and food banks. but we pay, a processing fee. So it's not that we're not paying anything for it, because of course they need to stay afloat. But we've increased our work with them tremendously. And that's been great for us to really have that fresh produce that's right from New Jersey. Some of the farms in New Jersey are so small, their prices are higher. And so it's hard for us. We have to make every dollar go further. But we're working with them and trying to still get some of those things, because it's amazing. If you can get produce that, is in the ground in the morning and is at a food pantry by evening and at somebody's plate that night, that's incredible. So we really want to do that. It's hard without the LFPA program, but we're still doing some of it. But a third of what we distribute is produce. I think people are surprised to hear that sometimes. That,
I'm surprised to hear that.
Yeah. That's, 30-something million pounds of produce every year that is being distributed to pantries. And it's the thing people choose. So I think there's another myth is that, poor people don't want to eat properly or don't want to make healthy choices. When there's fresh produce, it is what people want.
What was that number again?
It's about 34 million pounds.
Wow.
Yeah.
What are some of the other numbers?
I think proteins also. So fresh and frozen proteins or something. I think people think still of food banks as what they were, 20 years ago, where you'd go and it would all be shelf-stable foods. And those have a place. I mean, I'm sure we all have some cans in our cupboards at home. But we really want people to have fresh food as much as we all want to have that ourselves. I mean, when I go grocery shopping, I'm certainly spending more of my budget on fresh produce and on proteins than I am on shelf-stable foods. I think all families really want the same thing. And so the more that we can get fresh and frozen proteins and produce, that covers about 2/3 of what we distribute between proteins and produce.
And is most of that because the food bank is purchasing that?
And donations. We get a lot of donations from it. For grocery stores, it's a very good thing to be able to get some of their produce moved if they're afraid it's going to go bad in a few days. So for us, the challenge is getting it out quickly. And that is a challenge. But we get produce in, they won't give it to us. And if they by mistake do, we won't take it and give it to someone else if it's not still usable for a couple of days. But it really is that short a time that we have to quickly turn it around and get it out to pantries.
It is. It just sounds like an amazing logistical.
It is. And some days it works. And some days, we struggle because it is, if you all of a sudden get a truckload of blueberries, they do not have a long shelf life. And so you have to find not only pantries who can accept it, but who have large enough volume that they can get it then to people's homes so that nobody wants to throw out anything. That is always our goal, is to eliminate food waste. So really just turning it around very quickly is always our goal.
That's got to be a sight to watch.
It is.
All right, we have all these blueberries. Who's taking them?
Exactly. That's exactly what our staff are doing.
So what else? I mean, the people who are, let's say, doing the nutritious education or doing the navigator program, is this certain people have certain jobs or everybody can do a little bit of everything?
Well, nutrition education used to be that we had certain people in certain jobs. That too was cut through HR 1. So we laid off about 30 staff members that were going out and working with people. Especially one of the things with produce is some people are kind of scared of things they haven't used before or tasted before. So we would have somebody go out and do cooking demonstrations at pantries and show people how to use different vegetables, let them taste them. And then, maybe they're willing to take a spaghetti squash, even if they've never had it before, once they taste it and see that it's not that hard to cook it. But you have to kind of sell it. And so we used to have people who did that and who went to schools and taught kids about nutrition and about, how good some of these things can taste, which again, if kids taste something, they're kind of willing to eat it sometimes. So unfortunately, we don't have that program anymore. So what we've tried to do is we made a lot of videos with recipes and things that pantries can show to people, or we have recipe cards. So anytime we send out a food that we're like, oh, people might not know that very well, we're going to put a few recipes in with it to say, here's some things you can do with it. Certainly, if we know that a pantry serves one cultural group, we'll try to, make sure that we're using spices that are familiar to that group, and we'll put in recipes that sort of will work for them. So now it's kind of a lot of people's job to get our nutrition education out there. Not nearly as effective as when we had a team of people doing it, but we're doing our best to make sure that people, know what foods are good for them.
I'm just awed. I really am. No, I mean, when you think about people having to figure out what spices, put it together, put the cards together, insert it, and get it out so people can use it, which means you've got to keep the language simple, but instructional. And
yeah. And the college pantries, some of them have done a great job with that because they do serve an international population often. And so they really, they try to keep spices on hand. They'll get donations of spices. And that way you can give somebody, cumin or something that is sort of works with the food that their family wants to eat. And I think they've just done a really exceptional job of making sure that they're kind of working with people to make food that, we all know food isn't just food, right? It can make you think of home. It can make you think of your family. People want things that are familiar often. Even if they're willing to try new things, they want some familiarity in there also.
No, I mean, I have heard of some churches who do something similar where they'll
Yes.
have a cooking demonstration after services. So people who are not native here to America want to learn how to cook certain things
Yeah,
that
it's
are just
great.
different to them. I think it just makes a huge difference.
It does.
It's interesting.
We've also had people do drives for us of like coffee and tea, because those are things that people aren't going to spend their, coffee's expensive. Maybe if you're on a limited food budget, maybe you can't afford to buy coffee. But boy, everybody likes that cup of coffee in the morning. And it's such a treat to be able to give people things like that in a pantry also.
Interesting. What would you like to see changed in 10 years from now?
So much. Obviously, I wish HR1 could be overturned. We'll see what happens if some pieces of that maybe can get rolled back over time. I think it really does feel right now like a war on people living in poverty. And I think that is what I would like to change, is that we understand that most people living in poverty are not unwilling to work, are not unwilling to do what they can to raise their family properly. And I think we've lost that somewhere, the compassion towards people that really are struggling. Again, we have people who come and they're working 2 jobs to try to make ends meet, but their paycheck is coming Friday and they have something, they don't have any food right now. They are not people who are taking advantage of the system. And I think so I'd like that mindset to change, first of all, but then just how we invest in children and families as a country. I do, childcare tax credit is a perfect example. That was something that was proven to be effective, proven to work. And, the 25% increase in children living in poverty and who were food insecure almost overnight. If we could just support families more, I think as a society, that would just be so helpful. So yes, I'd like to see SNAP. We're lucky in New Jersey too. I mean, we have politicians who have really worked hard to keep SNAP at a higher level. The Assembly Speaker, Craig Coughlin, has done amazing work in New Jersey to make sure that the minimum for us is $95. Some states, it's as low as $28. Some states may eliminate SNAP, given the cost share that's happening with HR1 to the state. To me, that's unfathomable, that we are going to have children and families not being able to eat. And that is really what will happen. Because the charitable food system cannot cover what SNAP has been covering. So really just a mindset shift, I think, is the most important thing, that, we should be trying to support families and trying to see where the gaps really are and fill those in, rather than making everything about, higher and higher compliance to make sure that there's not the tiniest amount of fraud.
Well, I think given the fact of all the volunteers that come in, people seem to be getting a better sense of what you're saying and seeing a mindset shift, right? Maybe not, but
no, I think hugely. I mean, I think we saw that in November, that I know people that never would have even known what SNAP was, who were asking me like, oh, how are those SNAP cuts affecting you? Because it was on the news every day for the first time. That saw the lines that, we were doing food distributions during that period when SNAP benefits were cut completely at huge parks, like in Newark and in Bergen County, and actually almost in all of our 11 counties. We did massive food distributions, and there really were miles-long car lines for people coming. And people saw that and asked what it was all about and understood. I mean, the nice part for us is it meant people really did step up. We needed so many volunteers in November. We had them. And just by putting out a text alert to people in our system, they show up. People donated to make up the difference of what it would be. I thought we were going to have to, we try to keep about 6 months of reserves on hand in case there is some sort of catastrophe. I thought we were going to have to dip into our reserves. People responded in fundraising and paid for us to be able to make up the difference, which was incredible. And it's nice to see that people really, you kind of have to make people aware. But once they are, nobody wants to see people going hungry.
No, that's really, that's very heartening.
It is.
To hear that.
Yeah.
Because you don't always hear that about people. What else would you like to see change?
I think, it'd be great if people just got paid more. That sounds so simple, but I think wages have not kept up with the cost of living. And I think that's one of the things, we hear much more about affordability now as in political campaigns, everywhere else, but seeing that that's the reality, that if you take 2 people working with minimum wage jobs, being able to afford housing, health insurance, if their job doesn't always cover it, food, childcare, it does not add up. You cannot do it. And you could, maybe a generation or at least 2 generations ago. And I think that's something that's gone really wrong, that people cannot, maybe have the same dreams that their parents had about home ownership, or even just about being able to cover the bills for your family without having to work also evenings and weekends and not spend time with your children. So I think that affordability piece is really just something that we're going to have to grapple with as a society and figure out how 2 working people can raise a family and not be coming to a food pantry.
Right. And what do you think we can do to make sure that kids growing up understand the importance of nutritious food and what constitutes nutritious food? It's not the snacks I love, the soft or the sweet somebody else likes.
Yeah.
Like what
we
should
all do. We say there's no bad food, that you just have to, we always have to like the choose often, choose sometimes, choose rarely is the way we categorize foods. But it is all about education. And so one of the things we love is when kids on school trips sometimes will come to a pantry, we'll see what that is. We'll see a cooking demonstration, or we go into schools and do those cooking demonstrations. I know the farm I mentioned, America's Grow Row, has huge school groups that come, and they actually work in the field that day, and then they make something with those vegetables. And once you've picked something, you want to try it and see what it tastes like. And a lot of the kids like foods that they've never tasted before. So really just teaching people about that from a very early age, I think, is really the biggest challenge. Because once you're set in your ways of eating, it's very hard to change them. As any of us who've ever, dieted or had gotten health advice or anything else know, it's hard to change once you're used to something. So I think starting kids early on trying those foods. With our after-school feeding programs, we actually do taste tests, and we have our chefs have the kids fill out what they like and what they don't like and all of that, because they are getting vegetables and fruits, and we want to know which ones are the ones that they're actually eating versus throwing that part of the tray in the garbage. And the kids love it. They love that the chefs are going to listen to them and that they get to help pick the menus. And when they'll see a menu come, the next month, they're like, that's the one I asked for, And so I think it's really doable. And it's making the food taste good. Nobody wants to just have the same, boiled vegetable and, roasted chicken or something all the time. It's the variety. And I think just getting kids, used to trying new things and being willing to do that.
So talk a little bit more about that. How are you doing that with the after-school program?
We work with places like, say, the Boys and Girls Clubs. And so we are delivering meals there. And they get their last meal that way before they go home, so that if the family doesn't have dinner that night, or if they aren't consistently able to do that, children are actually getting their third meal of the day. They might get breakfast and lunch at school. They can get a meal before they go home. And so kids there, they get their meals, and then we do, every now and then someone will go, one of our chefs or one of our team who administers that program, and just ask them, what did you like? What didn't you like? What should we bring back more of? What are the things that, you really wanted? And of course, we ask the staff also, what are they turning up their nose at and what are they excited about? And then we try to tailor those meals so that they are things that the kids are really getting a nutritious meal before they go home.
So you're actually cooking them at the food bank.
At the food bank.
Packing them up and delivering them.
Exactly.
Wow.
Yeah, it's one of the some of our volunteers work in the kitchen, and they are packing meals and sealing them up and sending them off to kids in their community. It's really quite an operation. I feel very lucky. I mean, the team's amazing. And, so many of the people who work there have lived experience. So one guy said to me, I could drive a truck anywhere. Frankly, I would make more money. But I was hungry as a kid. And so the fact that I'm the person now bringing food to people, that's why I'm here. I'm that's just amazing. It's a very special group of people. We're really trying to make sure that they are people often who have been using food pantries but don't want to be in that position anymore. So they come to us, they can go through a training program, they leave with certifications. So they leave with, a certification that a kitchen at a restaurant will be able to hire them, or that they can work if they're doing the warehouse logistics program. They are working. They know how to use a forklift. They learn how to use all that equipment so that they can go get a job at Home Depot or Amazon or something that is going to start to lift them out of that paycheck to paycheck existence. So it is a really important part of our operation, and we hire some of the people from that too, as many as we can. Which is obviously a good feeling. A lot of the people who work at the food bank are people with lived experience with food insecurity. And it's a very important thing to them to work at a place that is helping to solve that problem. So, you could be a truck driver anywhere else. You could be an accountant anywhere else. But people do it because they really care about the impact that they are having in their community.
And it is so important. And to me, you see results.
Absolutely.
You do see that impact.
We do. I mean, one of our pantries who's very good at tracking their data, not everybody can because they're only working on volunteers or something, but one that has some staff says that if they can meet with somebody within the first couple of weeks of when they come to a pantry, they can get 50% of people out of that pantry line in about 3 or 4 months. That's incredible. Just by connecting them to other services, they might not know things they were eligible for, whether it's SNAP, or a job training program or something else that,
or payment of an electric bill.
Absolutely. Yeah. I mean, nobody's first choice is a food pantry. And so I think, and as nice as they are, that's not a dig in our food pantries at all. They're amazing. And I think they treat people with such dignity and respect. But I think the goal is always to get people to be able to be, to not have to rely on the charitable food system. And I think it's working when we can do wraparound services, when we have the ability to sit with somebody and say, what brought you here? And depending on what that is, be able to help them with other connections.
It's amazing. No, it really is amazing.
Yeah.
I'm very impressed. So is there anything else you want the audience to know?
I think just that it's very easy. If you want to help, there's so many ways to help. And again, you can come to the warehouse, cfbnj.org. There's ways to sign up, but your community pantry or your soup kitchen. And I think for a lot of people, it can be a life-changing experience to go and actually meet people who are struggling and see that they're not different than you. They might be in a different, tax bracket. But other than that, it's all people who just want the best for their family or for themselves or who are trying to work or who are trying to do things. Of course, we also have people who have mental health issues or addiction issues that are keeping them from those things. But there are more often than not, you're going to meet somebody at a food pantry that you can relate to and that you understand why they're there and why they're struggling. And so I think nobody has ever gone and volunteered and left with an attitude of, oh, these are just people looking for a handout. And so I think just getting involved in your own community is a great thing for people.
Well, I would recommend everyone do it. I know, again, when we came, we were just packing up the boxes.
Yeah.
And I had no appreciation for all the other things you do. So thank you for all you do. Thank your staff.
Thank you for coming and volunteering. That's great.
But I would encourage people to check out your website and find some way that they can also volunteer or donate.
Yeah. And the corporate groups who come also, it's a great team building experience. I mean, people have fun. We try to, we play music. We have, the staff who work with the volunteers are like very energetic, really try to make sure people understand how appreciative we are and that we couldn't do it without them. It's not, some volunteer jobs you go and you're like, okay, I did my thing, but did you really feel a part of it? Here, you would know that we could not do it without our volunteers. So I think that makes people feel good.
Well, thank you very much, Elizabeth, and good luck.
Thank you. And thank you for, making sure that people are aware of these issues.
Thank you so much for watching. Visit the description to find out more information about today's conversation. Be sure to leave a like, subscribe, and hit the bell if you enjoyed the video and want to be updated when our newest interviews are released.